or something simple, what antibiotic they would prefer a patient to be, for example, because sometimes patient just comes in the middle of nowhere requesting the script, and we would normally just give something according to the guidelines or something that we normally treat infection, oral infection with, but you don't know what the preferences of particular dentist.
Yeah,
I agree with that. The same with analgesia too.
yeah,
And you're not really sure sometimes about how genuine it is, especially if patient is requesting opioid analgesic. It is really common, yes. And I probably would say around 5 a week, yes, easy. I'll take the history, and there is a history of dental abscesses, for example, and I commend them on antibiotics and give them pain relief. But frequently patients do come from the dentist and they say, my dentist wanted me to be on antibiotic and pain relief. There is no knowledge. So, and what we're discussing, it would be lovely to get at least something really quick, just one sentence, or at least confirming that the patient was seen.
To confirm this, you would be open to myself saying, Olga, I've seen Ron today. I'm concerned about his blood sugar levels because his periodontal health isn't great.
Mm-hmm.
It's not commensurate with the amount of bacteria. Can you please follow up on his blood glucose readings and things
like that? Would be absolutely fantastic, yes. I would be even happy with a quick note that the patient was seen at all, but extra information would definitely be a big plus. Again, antibiotic or pain relief, or to acknowledge that the patient is seeing a particular dentist, especially if there is a very complex medical history or diabetes. I'm not sure how patients discuss their medical condition with the dentist, for example. Maybe some part of this information is actually missing. So I'm actually happy to write letter of referral to dentist as well, giving the full list of medication and medical conditions. And also would be interesting to know if the patient with the prosthetic joint or rheumatic fever would ever contact dentist, not providing this information and not put under the prophylactic antibiotic. Not routinely, unless it is related to oral health.
Yeah.
Or unless they're diabetic, I do check.
Yeah.
Or if you clearly see that the oral health is not up to standard. I just say dentist. It's a good point, but I just probably generalize for the sake of patient. And I think it's good actually. It's such a obvious question, but you asked me at the beginning, do I know the difference? And I do, but it's interesting how I would refer everyone to dentist anyway, regardless. It wouldn't even come at the back of my mind, actually.
Yeah.
And price-wise, is it cheaper for patient to see oral hygienist or dentist? Of
course.
Especially depends on what area GP practice is. And for area that I work in, we have 50-50 pretty much. So people who are quite they can afford services of that kind, and people who cannot afford it at all. So they would rather come to see me repetitively for abscess, but they would never go to dentists. Because they it is a really good thing to do something extra. So we just appreciate it. And I know that there are patients who just don't see GPs at all, especially the male population. But returning back to the question, how could you make sure that GPs are more aware about hygienists, is that if you send us a quick note, I think it may start rolling. Yes, and we'll become a little bit more discussion about that with patients, because we would always appreciate a little note. Some doctors probably would think about it increasing workload, but if the note is very simple and straightforward, without too much details and too much of this paste and copy and paste, big letter which we would be lost in, then it wouldn't be practical. But something simple and relevant, that's a great thing. Again, you need to see this kind of professional. The question would be straight away, how much would it be out of my pocket? Because frequently, even with supplementations, patients are unable to buy it, and they come back to me and question me why I requested such a big list, because they're unable to afford